Hello everyone, Dr. Matt Ed. Today we'll be talking about assessing volume status using jugular venous distension, hepatojugular reflex, and ultrasound to assess the internal jugular vein and IVC. Our learning objectives are jugular venous distension to estimate CVP, how to maneuver the hepatojugular reflux, and talk about ultrasound to assess volume status through internal jugular vein and inferior vena cava. To assess the jugular venous distension, first have the patient lie supine at 30 to 45 degrees angle. Ensure the neck muscles are relaxed and the head is slightly turned to the left. Use lightning to visualize the internal jugular vein. It is usually between the sternocleidomastoid muscle and the clavicle. Locate the highest point of the visible pulsation in the internal jugular vein. You can differentiate the jugular venous pulsation from the carotid pulse. The carotid pulse is palpable and has a single upstroke, whereas the JVP is non-palpable and has a double waveform, A and V waves. Next, find the sternal angle of Louis, and that's roughly located 5 centimeters above the right atrium, so it's around here in the sternum area. And then you will measure the vertical height in centimeters from this point to the top of internal jugular venous pulsation, and that gives you the JVP, jugular venous pressure. So normal JVP is less than or equal to 3 centimeters above the sternal angle. And to calculate the CVP, you would add JVP height in centimeters plus 5 centimeters. That's from the right atrium to the sternal angle. Normal CVP in centimeters is less than 8 centimeters water, and elevated CVP is usually greater than 8 centimeters. And this suggests conditions like right heart failure, volume overload, or pericardial disease. To test the hepatojugular reflux, have the patient lie at a 30 to 45 degrees angle. Ensure the neck is relaxed and identify the internal jugular vein. Use a firm and steady pressure of about 20 to 30 seconds over the right upper quadrant, the liver, which is right below the rib, the right rib. Keep holding. In a normal response, a transient rise that returns to baseline quickly, and that's regarding the jugular venous vein. And is an abnormal response, which indicates positive hepatojugular reflux, is a sustained rise in jugular venous pressure greater than 3 centimeters, lasting greater than 10 seconds, and that is with the pressure still held, and this suggests right ventricular dysfunction. Next, we'll talk about the IVC using ultrasound. So remember, in the subcostal view, you get the IVC, and you measure 1 to 2 centimeters away from the right atrium, and it's inner to inner vessel. Abnormal measurement is greater than 2.1 centimeters. With regards to IVC collapsibility, the patient must do a sniff like this in the M mode, and the normal collapse is greater than 50%. If it collapses less than 50%, that's abnormal. So we can use the measurement of the IVC in diameters in centimeters and the IVC collapsibility to estimate the right atrial pressure. If the IVC size is less than 2.1 centimeters and greater than 50% collapsible with the sniff, the IVC, the RE pressure is low. Estimate that to be 3. It is intermediate at 8 if any of these is abnormal. So let's say you have normal IVC size less than 2.1, but the collapsibility is less than 50%, which is abnormal, then estimate that to be 8. But if the IVC measurement is plethoric, greater than 2.1 centimeters, however with 50% collapsibility, then the RE pressure is also 8. But if both are abnormal, IVC size greater than 2.1 centimeters in diameter, and it is less than 50% collapsible, the RE pressure is estimated to be 15. Next, we'll use ultrasound to assess internal jugular vein to assess volume status. So first, you have the patient in the semi-upright position with a normal CVP. In a patient with normal CVP in the semi-upright position, the internal jugular vein will be collapsed in the middle of the neck, and you can see that on ultrasound. In the longitudinal plane of the ultrasound, the shape of the internal jugular vein in the transitional zone resembles a wine bottle with a wide inferior base tapering to a narrow superior neck, and we'll see that in the next slide. That will be the site of the jugular venous pulse, and usually it's measured at the end expiration. Here are examples of ultrasound images of the internal jugular vein. That's this V right here, and this is the longitudinal view of the neck showing tapering of the portion of the internal jugular vein right here, and this is like tapered down like a wine bottle. On the right, it is a transverse view of the right neck showing a collapsed internal jugular vein. So this is about right here, V. You see that's V. A is the carotid artery, and in a normal CVP, it should collapse at mid-neck. Thank you for watching. If you thought this video was helpful, please like, subscribe, and look out for my next video.